Horton@ua.edu. If you'd like to reach out, if you have questions, comments, feedback, or just want to connect, or if you'd like for me to come and speak at an event that you're having, I would love to do that. I'll also offer coaching services for UA faculty and staff, so that's also another option. So love to connect with you guys. My disclaimer is that this is for educational purposes only and that it doesn't constitute medical advice. This is one of our more medical heavy classes that we teach, but if you have specific questions or concerns, it's best to always contact your healthcare provider, your nurse practitioner, your physician's associate, whomever does your care. But I'm happy to answer general questions because we want to give you some good feedback and help you get started,
Mhm.
help you get
Yes.
started with your journey. Sorry for that, guys. I'm not sure what's going on with the announcement. So, our objective today is to identify healthy habits to help you reduce your cardiovascular risk factors. Y'all may not even be completely aware of all those risk factors, so we'll talk about those. Help you understand the relationship between cholesterol and hypertension, and then help learn the risk factors for both high cholesterol and hypertension, which is going to play a role in your overall cardiovascular health. And then identify healthy habits to reduce high cholesterol and high blood pressure. So, I want to start out with this. It's called Your Heart is the Softest Place on Earth. Take care of it. And the reason I wanted to include this slide, and this is not going to be in the slide deck that you guys have access to. Marina's going to pop it in the chat, but you're welcome to take a screenshot, or if you just Google this, it will pop the image up. But I added it because I want you to think about taking care of your figurative heart, because everything that you do to really take care of yourself well and to love on your heart and to give yourself love and to give yourself meaningful connection and purpose and all of that is actually going to help improve your physical heart. And so I want you to just think about that as you move forward. Sometimes when we think about our health and wellness, we think about it as improving our numbers, a better number on the scale, or a better number on your cholesterol, or a better number when you get your blood pressure reading. And that's all important, but sometimes if we focus too much on that, then we get fixated on the numbers and we don't really look at our life more holistically. We don't zoom out and realize that in our stress and in our hustle to achieve better health and numbers, that we can become so kind of in the weeds of that and the details and minutia that we're not living our lives. And the whole point of having a healthy heart and a healthy cardiovascular system is so that we can live a full, rich, meaningful life, not so that we can be kind of obsessed over our numbers. And so I have to remind myself of that. I think it may be important to tell others as well. So we're going to talk about cardiovascular disease. Unfortunately, it is the number one killer in the globe, in the country. And when you look at that, just really, it's astounding how many deaths you can have related to cardiovascular disease, or what's sometimes abbreviated CVD. So 18.6 million deaths every year are associated with cardiovascular disease. That's heart and stroke and other related conditions. That accounts for 30% or 33% of all global deaths, and then greater than 75% of those deaths are going to be in the lower to middle income countries. And so that can be because of health disparities, that could be because of lack of resources, it could be because of lack of access to healthcare facilities or emergent care. And so that's something to really think about in terms of heart health plays a huge factor, even more than cancer, which we usually hear about more often. And then, of course, more than respiratory diseases, HIV, and other diseases that you may actually hear more about. So, risk factors include high blood pressure, high cholesterol, being overweight or obese, air pollution, and other environmental factors. It could be physical inactivity, unhealthy diet or nutrition, having diabetes, having a tobacco history of usage of that or nicotine or other harmful substances, kidney disease, and then also excess or harmful use of alcohol, which that looks different for men and women just based on the metabolism guidelines and usually the weight and muscle mass of men versus women. Again, we talk about these in terms of binaries because that's how the data reports it. But it's really more than just about hormones or the fact that you're a man or woman. There's other components there. But it looks at, how many drinks that you consume a week. A lot of times people are going to say less than, 1 to 3 drinks for women. And then men, sometimes you'll see as many as 3 to 6 drinks for men. And so you also can look at per usage. So how many drinks you have in one night in one sitting versus how many drinks that you have over the week. So it takes into account binge drinking. And so if that's something that you're really wanting to explore more, there's lots of great information. And just do a quick Google search and look at the guidelines for alcohol consumption, and it will give you those usually by age and by gender. So, heart disease and stroke then accounts for 1 in 3 female deaths each year. And that's typically reported at the national level in the United States. And so, while this presentation is for anyone, I do want to just comment that sometimes we think about cardiovascular disease and heart attacks or strokes being something that's mainly affecting men, and that's not true. Women often will present with different symptoms and will have different like presentations of symptoms, different issues and challenges related to their heart disease. And so I think it's really important that we shine a light on that. And so the American Heart Association at the national level has the Go Red for Women campaign, which I'm sure you're all familiar with. And they actually have an acronym for Go Red to help create awareness around female cardiovascular disease. So we'll explore that a little bit more. And then cardiovascular disease, what does that actually refer to? It is not just the heart, but it's also the blood vessels. And, it puts you at risk when you have things like high blood pressure, high blood cholesterol, tobacco use, diabetes, or what we call metabolic syndrome. And so this is not just about heart health, but it's also about brain health. So, to really simplify things, the same issues that cause a heart attack are the same issues that cause a stroke. It's just where the issue is, whether it leads to an issue with the heart or an issue with the brain, and sometimes it can lead to both. So, creating awareness, Go Red is actually the acronym. I think a lot of people didn't realize that. I didn't realize that at first. But get your numbers. So, know what your numbers are. Know what your BMI is. Know what your weight on the scale is. Know your cholesterol numbers, and not just your total cholesterol, but the individual numbers like your LDL, your HDL, your triglyceride. All of those numbers matter, and then own your lifestyle. So make sure that when you're, looking at this information today, kind of do a self-assessment. Where are the places that I need to make changes? I'm in a season right now of making my own changes and really assessing my life, because the things that got me to where I am today in terms of my health and my weight loss journey is not what's gonna get me to the next level of health and weight loss. And so I'm doing a lot of self-reflection right now on where do I need to make changes, because when you have a lot of changes that you need to make, it can be kind of exciting if you look at it in that way, because anything that you do is going to improve your situation most likely if it's a healthy habit or a healthy change. But once you've implemented a lot of those strategies, then you have to really get even more nuanced and think, okay, if you're at a plateau with your health and your weight loss, or any kind of plateau in your life when you feel stuck, it gets a little bit harder to kind of up level and to make those changes because you feel like you're doing everything. So regardless of where you are on your journey, own that, have some of that radical accountability, but also some radical self-compassion for just being human. And, think about today, where do I want to make a change? And then realize your risk factors. It's important to know your risks so that you can try to do everything you can to what we call mitigate those risks, and then educate others. I think it's always important that when you learn something that you pass it along. The biggest compliment that I get from one of my classes is when you say, "I really enjoyed that. I shared it with my friend or my coworker or, my loved one or my neighbor." These all become YouTube videos, and so it's really easy to go to our website, grab the link, and send it out. And we would love for you to do that because we want everyone to know about good heart health. And then don't be silent. And so if you feel like you have a challenge, a risk factor, a concern, don't be silent about that. Reach out for help. That's so important. So, Go Red for Women, this is the declaration that the American Heart Association put together, and I'll leave this here for you. This is going to be in your slides so that you can read through it. But it just talks about taking a stand against heart disease and fighting side by side for as long as it takes to really advocate for women. I read some, latest research a couple of weeks ago, and it talked about on average that women tend to go to the doctor or to the healthcare provider um, 3 to 4 times more than men do. And when that statistic is given, and this is something that I've never shared on one of these classes because you're the first class after me reading this, but it makes a lot of sense. It talks about, men are so reluctant to go. And of course, we're being very stereotypical here in our language around this. So please forgive that. But, the language and the conversation has been that, oh, women just are hesitant to go to get health care. They don't go as often as women, etc. And a couple of ways that they've explained that in the literature and just in, medical conversation has been, oh, well, women are caregivers, so they're more likely to be the ones to take kids to an appointment, or they're more likely to take loved ones, a parent, a neighbor to the, to the healthcare system, to the healthcare appointment. But then when looking at this research, all of that is true. And it's also true that now women are going to see a healthcare provider on average 3 to 4 times for every time a man goes to get a diagnosis and gets treatment. That's how often a woman has to go back with the same problem to get the same level of treatment. And so I think it is important to acknowledge that yes, women tend to take kids to the doctors more. Yes, women tend to be caregivers more. That's kind of our societal expectation of women. Um, and so that's also true, though, that we usually tend to have to go more often before our healthcare and our healthcare needs and our challenges and our medical conditions are actually diagnosed and addressed. And so I think that's a very interesting way to change the conversation around. Women need to be believed when they have symptoms. It's not just stress. It's not just anxiety. It's not just about losing weight. For me, in my own personal story, when 2018 showed up to my doctor's office with stroke level high blood pressures. And there were a lot of reasons I think that that was, the case. I ended up last year being diagnosed with a liver tumor that was on my adrenal gland. And so it was really not a matter of think positively. It was a matter of I had a tumor that was causing real hormonal disruption and challenges with my blood pressure and my weight and a lot of different health issues. But the resounding, feedback that I would get, no matter who I saw, no matter where I went for care, in the state, out of the state, physician, a nurse practitioner, it didn't matter. The first things that were said was you need to manage your stress, you need to lose weight, you need to make sure that you're not, overly anxious. Have you considered something for anxiety? And it really wasn't a conversation of maybe there's a root cause that we haven't identified. Maybe there's something else going on. It was all about weight and anxiety and stress. And those are important. And those are kind of easy to spot and see, okay, yeah, she is overweight. Look at the numbers. Yes, she's saying she's stressed and she's anxious. But we need to dig a little deeper. And when I woke up from surgery, I immediately felt like a different person. The tumor was having that big of an impact on me. And I'm sharing my personal story to encourage you that you need to advocate for yourself and you need to believe yourself and trust yourself. You have your intuition and it's so strong. So never doubt that your intuition is wrong. You know your body best. And even though I had all of the textbook knowledge, the head knowledge, the experience of been a nurse for 14 years and, have walked alongside patients and helped advocate for them, there were a lot of days where I had self-doubt around whether or not, it was just stress or it was just anxiety or it was just being overweight. And so, I was very fortunate to get a diagnosis and to get help, and my whole life has changed. We need to see where we can do that and advocate for that, for ourselves and for our loved ones, and for those of us who are in the medical community, how we can do that well as in addition to the work we're already doing. So, I'm super passionate about that. Thank you for letting me share my story. But it all started with hypertension for me, and so cholesterol and hypertension often go hand in hand. And there are strong genetic components to this. You will hear people talk about epigenetics and they'll say, Genes really set you up for the, challenges or the health concerns that you have, but your lifestyle is really what is the trigger for that. And the thing about it is that's true, but I think we are now kind of overcompensating and saying that lifestyle, you'll hear the statistic that 5% of cancers and genetic conditions and all of these medical problems that we could talk about today are influenced 5% by your genes and 95% by your lifestyle. I don't know that I totally agree with that. I think it looks like that on the surface, but I think it's more nuanced than that. Certainly, genes play a big role. That doesn't mean that you can't make good changes. It doesn't mean that you can't overcome your genes, but it just means that you have to be more mindful about the choices that you make. And you might not be able to eat the same, kind of lifestyle, nutrition that your neighbor does, or even your spouse, or even your kids. And so I think it's important to realize that there's still so much about genetics and how that plays a role in our health that we don't quite understand, but you're going to hear people talk about this in absolutes. And most of the things that we report on are really probabilities. It's probable that this is going to happen, but it's not an absolute. And so I hope that gives y'all a lot of hope that you can make changes. For cholesterol, cholesterol is just going to be that fat that circulates in your blood, and it performs a number of really important functions. What you're going to hear is when you have cholesterol issues, you're going to hear that you need to change your diet, and that's so true. But you only get cholesterol from dietary sources, from what you're eating, about 25%. So that's going to be things like eggs and cheese and dairy and like meat, especially red protein. That's gonna be 25%. So what you're not hearing is the 75% that your liver is actually making. So for me, I had a liver tumor that had been growing for 10 to 12 plus years, and that tumor was causing me to have high cholesterol. And so I was getting counseling on my nutrition about what I needed to be doing to lower my cholesterol, and nothing I did actually improved those numbers. And it didn't improve those numbers because I had a tumor. Now, everyone doesn't have a tumor, but there are other things that will cause your liver to make too much cholesterol. If you have a high, inflammatory diet, if you're eating a lot of processed foods, your liver is going to make more cholesterol because cholesterol is like the band-aid that goes in your body and patches up the areas that have been damaged by too much sugar or by having too much inflammation in the body. And so cholesterol is going to increase because it's trying to help your body take care of itself. It's the patch or the band aid that goes out and helps those vessels and those organs. And so yes, it's needed. Cholesterol helps with, all of the hormone synthesis and making hormones and all of these functions in the body at the cellular level. It's needed. And yes, if you have cholesterol, you do need to be mindful of what you eat. But if you have high cholesterol and nothing you do changes it, there's probably something else going on. It could be that you have, exposure to mold, or you have toxin buildup, or something else is going on. Maybe you have a sluggish gallbladder and that's impacting your liver. I don't have a gallbladder. I actually had a lap chole several years ago after my first pregnancy, and so that puts more of a burden on your liver. So your liver tends to respond in that sense. And so there's so many things beyond just you're eating too much that's impacting your cholesterol. So again, that's another important piece to kind of keep in the back of your mind. And then in the high cholesterol, you look here and it talks about 54% of people admitted to the hospital with a heart attack have high cholesterol. The important thing to note here is that almost half don't. And so people who have a heart attack, like my mom had early onset heart disease before age 55 as a female, and she had a heart attack in 2007, and then she had another heart attack again in 2021 and had open heart surgery in 2007. And so she has two grafts. And we just recently learned that one of her grafts is occluded. And she's done everything quote unquote right, but she just has a lot at play. And so when you are talking to someone who has that kind of heart health history, you have to kind of respect the fact that genetics are at play. You also have to take the steps that you know that are going to help you. And managing your stress well and doing some of these lifestyle and dietary changes are absolutely important. But giving yourself grace, if you know that you're doing everything right and you're not seeing those numbers change, having that conversation with your healthcare provider is critically important because there may be something else going on that is affecting your ability to change the health that in the way that you want to. So things that you can do, you can stop smoking, you can stop using nicotine, you can stop using any other kinds of substances like that, vaping, anything along those lines. You can make heart healthy eating and dietary choices, but even drinking, making sure that you're not drinking a lot of sugar and calories is important. So, more water. I always say add things in first, not subtract first. I don't know if you're like me, but when I was a kid, I didn't mind doing math as long as it was adding. I didn't want to subtract anything though. So, add in the good stuff. So, if you're like love a Coke or love, a sweet tea, then instead of trying to cut out the sweet tea and the Coke, try to add in more water. And if you're drinking more water, then you're naturally probably going to cut back on the other things that aren't as good for you because you're just not going to have room in your schedule or in your belly to drink all of that. So that's a good move for me. I think that's really helpful. Because I was always thinking about healthy lifestyle choices as taking things away, like taking things that I love away. And so for me, switching to the mindset of adding things in was really, really helpful. Losing weight, moving your body, taking any medications as prescribed is really important. I always like to tell my success story of it took 4 years. I lost 85 pounds and I got off my pressure medication under the supervision of my cardiologist. I have mitral valve prolapse, and so I had to have a cardiologist manage my high blood pressure. And it was not easy to do, but it was possible. And I think when people hear that they get put on a cholesterol medication or a hypertension medication, it's very rare to hear someone get off those medications. And so that's why I'm telling you more of my story because I want to hopefully inspire you that either to avoid this altogether or that maybe make changes and ask your provider how they can help you if that's something that's important. For me, I took a particular medication that's very popularly prescribed to young people with high blood pressure, and it really affected my mood. It caused a lot of like kind of mood disturbances for me that I didn't even recognize. I thought it was just situational being a young mom or being in graduate school or working full time. And when I was finally able to stop taking the medication, it just never occurred to me that that medication could be causing my low mood and just not feeling great. And so I finally mentioned it to my cardiologist. I'd gotten a new cardiologist, and I said, my mood has been different since coming off of that medication. And she said, oh, yeah, you won't see that written in the literature, but it's really widely known in the medical community that medication affects your mood. And so I was like, well, that would be great if that was in the literature because everything that I have access to, which is a lot as a nurse educator, never mentioned mood. And she said, yeah, she said it's kind of one of those unwritten, unspoken things. I'm like, well, that would have been really helpful to know. That would have been another incentive for me to get off that medication with supervision. So hopefully these stories are helping me. Let me know in the chat if so. I'm a storyteller. So your blood pressure, when you look at your arteries, just know that when that cholesterol starts to deposit, which is this yellow right here in the graphic, it's narrowing that artery. So it's making their pressure have to be greater to get through that narrowed space. It's just like your garden hose when y'all come to get those out during spring break, if that's on y'all's agenda like it is mine, and you get your water hose out and maybe it corroded a little bit over the winter and you go to turn on the water pressure. And if you notice that there's some corrosion in the line, there's that iron that deposits in there sometimes. You know that then if you get a kink in it, or if you get, like a loop in your water hose, or you get that buildup internally, that you have to keep cranking on the water pressure to get the water to go where it needs to go, right? Which is out of the hose, out into your yard. It's the same thing with your blood vessels where you're trying to get that blood out into the body or back to the heart to get more oxygenation. And so the more deposits you have, the more of that yellow cholesterol represented here, the more difficult it is to get that there. So your blood pressure is just the pressure that then increases to get the blood to the body and back to the heart. So hopefully that makes sense. Um, Most people don't know that they have high blood pressure at first. And, we call it the silent killer because we say that there's no symptoms. Well, textbooks tells us that there's no symptoms, but having had high blood pressure, I can tell you that there are symptoms. We just are really, it's easy to ignore them. So usually you'll get like a headache, you'll get kind of a scratchy sensation in your eyes. You might have dry eye. You might feel more tired and fatigued. You might have low mood. You might just kind of feel run down. All of those things together, especially if you get kind of a pounding headache or a pounding sensation, you definitely have symptoms with high blood pressure. It's just we say that it's stress or we say that we're tired or, oh, we think we're sick. But if you have those symptoms together over a prolonged period of time, then you probably have some high blood pressure issues. We say high blood pressure and hypertension. High blood pressure, anyone can have high blood pressure. Everyone has high blood pressure at some point, probably because we are just living life and we're stressed. And if you get in a car and you accidentally need to, tap the brakes because you think you're not going to hit the person in front of you, then you're going to have high blood pressure because your body's responding to that, right? It's trying to prepare you for this stressful situation, right? This kind of saber-toothed tiger that we always talk about when we talk about stress. But that doesn't mean you have hypertension. You're just having a normal blood pressure spike due to stress. If you have 3 or more readings of a high blood pressure, then that's when you typically get diagnosed with hypertension, and that's when they start to treat you, especially if you have stroke level blood pressures. So I don't really think high blood pressure is a silent killer. I think it's cholesterol. And so cholesterol is really usually, for most people, what causes that high blood pressure reading to start with. So they'll say, oh, your blood pressure's high. Let's look at your other labs. And they'll say, oh, that's interesting. Your cholesterol's high. Well, it's really not that interesting because you almost would expect it to be because that's usually the most common reason why your blood pressure is high. Now, you can be pregnant, you can have hormonal things going on. You can have other reasons for high blood pressure, but typically it's because of high cholesterol. So it would actually be more surprising to me if you had high blood pressure and consistently had those readings and didn't have high cholesterol. So for me, I was textbook. I had high blood pressure and high cholesterol. And that was something that had not been caught before. And so it's just something that you want to be aware of. That's why well-being screenings are so great because you're going to get your waist circumference, your BMI, your weight on the scale. You're going to get all of your cholesterol readings, your blood sugar numbers, and get some great coaching by our nursing students to learn how to start making some of those changes. Plus, you get your $50 gift card, which is always a nice incentive. So think about that. If you've not done your yearly health screening, we would love to see you there. And I will be there this semester if you come in the spring. And so come say hello if you stop by. But most people who are admitted to the hospital with a heart event have high blood pressure. So that number is a little bit higher, 62%. And high blood pressure can cause a number of issues, not just cardiovascular health issues with your heart and your brain, but other issues. And so other things to consider then are how are you going to make some changes and do you know your numbers? So, this is one of my favorite things to talk about with cholesterol because when we teach students about cholesterol and sometimes patients, we say that there's good cholesterol and there's bad cholesterol. Well, I'm a believer that if it's in your body as a natural process, it probably is not bad. It's probably necessary. And that's true of LDL. So we kind of villainize LDL. You see, it's made to look like a devil with a pitchfork, which is just, you know, really, you have to really kind of think about the way that we frame this. And then you've got HDL as the angel. And this is typically how it's depicted and talked about. But here's the thing. LDL is necessary, but we say that it's the bad or the L is the lousy cholesterol and the H is the healthy or the helper cholesterol so students and patients can remember. But guys, we both need LDL and HDL. We have to have both. And so I don't like that we do it in this way, but it does help people to kind of remember. And so that's the purpose of it. But cholesterol is mainly fat and lipoproteins. And a lipoprotein is cholesterol, protein, and fat or triglycerides. And so What you have to look at is if y'all remember Pac-Man, so LDL is going to go out into the bloodstream and it's going to go out and do all of the patchwork, right? It's the band-aid. It's filling the gaps where vessels are getting little nicks and little, kind of injuries, and it's going out there and it's patching them. Well, when it gets done, the LDL then needs to be used or it needs to get recycled. Okay. Well, if it's not used, so it meaning that we ate too much cholesterol, our liver made too much cholesterol, the cholesterol circulated through the bloodstream to the body, it did all the repairs in the vessels that it could, and now there's all this extra cholesterol left over. What do we do? Well, it needs to get used. Okay, it didn't. So now it needs to get recycled, right? Well, if we don't have enough HDL, that's going to be that lower number that we say we want to be around 60, and a lot of people's is usually around 20 or 30. That HDL is a ratio of how many helpers to how many LDLs. Well, if you don't have enough helpers to kind of Pac-Man or gobble up this extra LDL to get it back to the liver to be recycled and reused, then it floats around in the bloodstream. And when it floats around in the bloodstream, it doesn't have anywhere to go if it doesn't have anything to fix. And so that's when it starts building up on the walls of those vessels where we saw it in that first picture, and that's where you can start getting things like the narrowing of your vessels, or the what we call plaques, which are like those pimples that you get that just kind of burst and cause a blood vessel to rupture. And so that's why LDL is considered the lousy or the bad cholesterol, because it's the one that kind of gets blamed for the problems, but it's really just a symptom. And then you've got red blood cells that also comprise all of this. So they all work together. So cholesterol is naturally found in our bodies and in the foods that we eat. It's in every cell of our body. It's required for hormone synthesis, so meaning that your hormones need cholesterol to be made. And then it helps with vitamin D production. It helps when we get vitamin D from the sun, and then it's just a number of other body functions. So it's a soft, fat-like, waxy substance. So when you think about gallstones or you think about cholesterol, it's a very waxy, almost kind of thick jello-like consistency. It's not truly stones, and it's not truly kind of a hard substance like you would think a cholesterol deposit would be. Cholesterol, like I said, is normal and it's a healthy, necessary aspect of your body and your health. And it's so important to think about how you are spending most of your time trying to make nutrition changes because that's what you have control over. But really, we've got to look at liver health. And liver health is so much about your full body health, reducing exposure to toxins, detoxing, helping your detox pathways be open, that sort of thing. And then your body also then really looks at how do we use this cholesterol well. So we've talked about HDLs, we talked about LDLs, and then now we're going to talk about triglycerides. And triglycerides are really going to be that source of fat that you sometimes will see as trans fats. So we want to have zero trans fats as much as we can, especially with processed food. So we'll talk a little bit more about that, but it's the fat that gets circulated in the body. So this is the picture of what I was talking about, where the liver sends LDL out, which carries the cholesterol to the cells. It goes into the artery or to the vessels where all of your blood is. What doesn't get used to patch up the vessel then will get kind of formed in this plaque if there's not enough HDL to remove the excess cholesterol and take it back to the liver to be recycled. So I always think a picture helps. So triglycerides then are that type of fat that gets stored in the body. So it's the kind of fat that you get from having too many things like butters and oils and eating too much fat from like a protein source. When you overeat calories, sometimes it's because you're not getting enough protein. And so then you can overeat fat and sugar. And so it's really important that you think about getting protein first thing in the day. The new recommendation for most people who don't have, things like kidney disease or other contraindications would be to have 30 grams of protein, like accessible bioavailable protein from a real source, not like a protein powder, but 30 grams of protein from a food source within 30 minutes of waking up. a new kind of study coming out about nutrition recently, I saw over the weekend, said that our body will overeat calories because it has a need for protein. And if we don't give that to our bodies the first thing in the morning or whenever we break our fast, breakfast is break fast. If we don't do that, then our body is constantly trying to consume calories all day long. So, eating a very American diet of pastries and sweets and things for breakfast and breads um, will actually make all of that worse because we're not eating a lot of protein or fat with that meal. And so when your body needs energy, it needs to be able to release the fat that gets stored. So it needs triglycerides for energy. But a lot of times we make it inaccessible because it gets stored to the point that it's hard to get that back. So having a constant source of protein is really important for your day-to-day energy levels. So triglycerides are not bad. It's just not great when we overconsume and then we overconsume calories because we're kind of in this protein deficient cycle. So our normal levels, we want to see your triglyceride level be less than 150. Borderline high is going to be 150 to 199. High is going to be 200 to 499, and then very high is over 500. Once you get close to 200, they'll start talking about medications for you because that does put you at a high risk for heart disease and metabolic syndrome, which is all of these symptoms we've talked about combined. So types of fats, there's more healthy types of fats. So you've got trans fats, which are going to be artificial preservatives. So it's going to be more of like human-made chemicals. So this triggers the liver to make excess cholesterol. So if you have high cholesterol, you definitely want to avoid trans fats, and that will be listed on the packaging on your food. If you're eating packaged food, try to eat more like produce versus packaged or processed because they're not going to have those trans fats in there. You don't even have to worry about the label. Foods that have a label are going to be the foods that you want to really be mindful about eating. Foods like apples or, lettuce that don't have a label, that's going to be a better source of nutrition for you. It's always better to eat your foods. For most people, there are some exceptions to eat your nutrients and your vitamins rather than taking a supplement. Supplements are just that. It's to supplement what you can't get in your diet, but it's always going to usually be better for most people. There are some exceptions to everything, but most people just need to eat that and then supplement based on what your provider tells you your blood work is showing, because that will change pretty frequently. Unsaturated fats are going to be your healthy fats that you need to consume more of. Things like salmon and avocados, almonds, walnuts, olive oil, flaxseed. Those are the kinds of healthy fats. I like butter. I believe in moderation. So I'm going to eat butter in moderation over margarine. I don't eat margarine. So if it's something that has been made in a plant, I try not to eat it. Now, you're going to see me eat and drink my Chick-fil-A and enjoy that. But when I'm making a healthy choice, then I'm going to eat the butter. I'm not going to eat the margarine kind of thing. And then saturated fats, animal fats, full fat dairy, all of that again will trigger the liver to make excess cholesterol. And it's going to contribute to that 50 to 60% of the cholesterol that the liver is making versus what you're consuming. So, cholesterol is that soft, waxy substance, like I said, that helps with all of these body processes. And it's really important that adults be screened routinely for their cholesterol. I've put this in here because it talks about the ratio. So, really, what I want you to see is your total cholesterol is your LDL plus your HDL plus your triglyceride numbers divided by 5. And so, your total cholesterol number often will be high if you have a high HDL. So you can see people who have HDL of 60 or 100, or sometimes the cholesterol machines at a screening will only say it's 100 plus. It's greater than 100. It can't even track it. So your total cholesterol number may be really high, but it's important for you to look at all of the numbers individually because you may have a high cholesterol and still have a good LDL number and still have a good triglyceride number. So I think that that's important for you to realize. So if they tell you, oh, your total cholesterol is 220, say, okay, can you tell me my individual numbers and break that down? Because it may be that you're right on track, that you just have a really high HDL, which is a good thing. HDL, I think, is harder, in my opinion. This is just Abby's opinion. This is not my medical opinion, but in my opinion, it's harder for most people to improve your HDL level than it is to lower your LDL level. So again, I think there's a lot of genetics and things at play, but increasing your fiber, increasing your omega-3s, knowing that you're taking like something like fish oil or working on your stress. There's lots of different ways to approach raising your HDL level, and a quick Google search will give you a ton of ideas. But it does take a lot of work. So just know that it's probably going to take 3 to 6 months for you to see improvements or changes in those numbers. And it may be very, very small changes. I'm talking about moving less than 10 points in 3 to 6 months would be a really good improvement from my experience, personally and professionally from my experience. So cholesterol levels, again, this is going to be for people who are considered adults, so over age 20, and the numbers are here. So you want to be, again, in the range where you're less than 150 for your triglycerides, less than 200 for your total, less than 100 for your LDL. You sometimes will see that be a little bit higher than 100 and then greater than 60 for your HDL. And then you've got borderline, and then you've got too high or too low in the case of HDL. So excess cholesterol in our bloodstream can accumulate in the lining of the arteries and impact our heart health, and so our brain health as well. And it can make your arteries, your vessels less flexible. And that's when they tend to break and rupture. And so you've got something like hypercholesterolemia, that's going to be your high cholesterol, atherosclerosis, which is going to be that hardening and narrowing of the arteries. You've got heart disease, and then you've got heart attack and stroke. And so it's really important to note that while we say that high blood pressure is a silent killer, there really truly are no symptoms of high cholesterol. So that's why you really need to make sure that that gets screened. So other health concerns, you can have poor circulation, and then we've mentioned these others here. So things like neuropathy or pain in the legs, you want to make sure that you understand if you have risk factors for those things, and you can learn how to take care of your, feet and your hands and your periphery, like all of that peripheral circulation when you go to appointments. So you can ask your provider to show you how to check for nail health and things like that. That's a good indicator of how your blood circulation is looking at your nails, your toenails, and your fingernails. Particularly if you have diabetes, your foot care is really important. So ask for that kind of education if you're not getting that. This is an example of what it looks like for a normal artery if you're looking at it like you would look through a hose pipe. And so this is just a little bit of cholesterol plaque forming. This is advanced, and then this is last stage. So a complete blockage, you can see it's not completely blocked. A complete blockage, when someone tells you that, they can usually estimate in a percentage. A complete blockage is usually around 70 to 80%. So that means 70 to 80% of that vessel is occluded, and they call that a complete blockage. And I think that's important because we often think a complete blockage would be 100%, and it isn't, thankfully, because that's going to cause a lot of issues with poor oxygenation, and definitely some long-term complications there. So inflammation plays a huge role in this. So if you're having a lot of, sustained inflammation, maybe you have an autoimmune condition, maybe you're eating a diet full of a lot of inflammatory triggering foods or something else, maybe on the positive side, maybe you're a professional athlete and you're playing and you're working out a lot. And, even people who aren't professional athletes, you're working out a lot. You're going and doing things like CrossFit. You're going and doing high intensity interval training, which can be healthy for some people. That is going to lead to a lot of chronic inflammation for most people. And so that can trigger some cholesterol being made. And so again, this is just another view of how those blood cells are having to go over that cholesterol plaque. So knowing things like your C-reactive protein, your SED rate, there's some other inflammatory markers. Mine were consistently high, and no one could ever tell me why. Well, it ended up being the tumor, but there was a lot of mystery around, why are my SED rate and my C-reactive protein markers so high all the time? Well, that was why. But that had been noted for many, many years before the tumor was ever found. So I say that to say, just always do your research and dig a little bit deeper. Again, most people are not going to have something like a tumor. It's going to be something a lot more simple. I hope that's the case for most people. My situation was very, 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 very rare. But I just use it to illustrate that there are other things that may be going on, other challenges that you may need to address that not, that's not attributed to just kind of the simple things like addressing stress. That's so simple, but it's not easy to do. Some other warning signs of clogged arteries are stroke, fatigue and dizziness, shortness of breath, chest pain, low back pain. Can be erectile dysfunction for men. It could be pelvic pain for women, painful or numb or cold hands and feet, which is going to be that neuropathy that we mentioned. And then this is what I talked about earlier about the blood pressure. I wanted just to include a couple of slides to really illustrate how that works. But I think the hose pipe works best to give you the analogy of that. And then again, you've got normal opening here, and then you get pre-hypertension as you start to have that narrowing. So this would be the yellow is represented by this lighter red pink color. And then you're at hypertension when you've got more of that complete blockage. And you can see it again here. I think pictures really help. So the diastolic pressure, that top number, you've got the diastolic, you've got the systolic pressure. So you've got systolic over diastolic. When you've got systolic, it's going to be that top number where it's measured between the heart contracting. So your heart's contracting to get the blood out, and then it relaxes. That's the diastolic pressure. That's in between beats when the heart relaxes. So when your diastolic number, that bottom number on the equation that you get, when it's high, that's usually when you're more tired and fatigued because at rest, when your heart's supposed to be opening up and relaxing and letting blood back in, your heart's still beating really fast. And so people see the top number, and that's always going to be higher usually than the diastolic number. People kind of panic over that, and no one should panic, but they kind of see that as more concerning. But usually, it's when you see that diastolic, the bottom number, that's high when you feel so bad because your heart, even at rest, is still working really, really hard. So typically, you're going to see this number go up first, and your diastolic may stay in the normal ranges. And then eventually, this is going to creep up, typically, if it follows the typical pattern. So, hopefully, that is a helpful illustration of how the blood pressure can change. So hypertension numbers, we want it to be less than 120 over 80. Before, if it was in the 120s or the 80s, you were good to go and you're considered having normal blood pressure. But now they have changed this within the last few years. I think maybe 2019, they changed it to be if it's above 120 or if it's getting over 80, then you're going to be in the elevated range because they've seen that those numbers can change rather quickly. So they actually want you to be less than 120 and less than 80 now. And then here are some recommendations again about the different levels. So looking at, recommendations for heart and stroke risk assessments and things like that. And so this is going to be here for your review. And of course, if you have any concerns about this, just talk to your healthcare provider, come to a health screening. We can make some recommendations for you in terms of where you can go and get more assistance. But anytime you have a high blood pressure reading, it's always good to call your healthcare provider and let them know and let them give you some good advice based on your personalized situation. So we have some kiosks around campus. We have the one at the student uh, union, the student center over by the Starbucks in the stairwell. Just across from Starbucks and right before you get to the soup store. And then we have one over on Flint Drive at the HR building. So for the employee health, there's one there. And then, of course, you could go to any, kind of pharmacy, grocery store. You could have your own at home, but it's important to monitor your blood pressure if you do have high blood pressure or if you suspect that you might. And I think it's always good to use the same machine just to make sure that it's calibrated and you're not getting differences in that way. You can also take it in different arms. So taking it in the same arm more than once is going to elevate it somewhat. Having the wrong blood pressure or size can also impact it. So just make sure that you're being consistent in the way that you're tracking your symptoms and tracking your readings. Hypertension symptoms can be all of these things. So irregular heartbeat, pounding in your chest, neck, or ears. It's kind of that feeling like you feel your heartbeat in your head. Visual changes, even kind of in extremes, blood in the urine. And you can even have fatigue or confusion. Shortness of breath, I think headaches, we've talked about that. Flushing, feeling like that redness in your face, or having frequent nosebleeds can be a sign. And then again, I mentioned this 3 or more readings are usually going to be what is required, excuse me, for a hypertension diagnosis. So you're going to want to do that, follow up with your provider to make sure that you're tracking that. Health effects of high blood pressure. Again, you're going to have things like stroke and heart failure, which we've mentioned, but you can also have visual disturbances and loss. You can have kidney disease, and then you can have just, sexual dysfunction, but really any kind of organ dysfunction once you get to this point with continuous high blood pressure readings. But remember, there's hope to make changes. So there's some numbers about, how many people are impacted with hypertension. It's a lot of us. Over half of the population have issues with high blood pressure, high cholesterol, and high blood sugar. So high blood sugar goes hand in hand because if you have high blood sugar, you have more sugar circulating in the blood. So that's making your blood stickier, or what we call more viscous. And then that's going to make it even easier for those deposits or plaques of cholesterol. So again, if you've got high blood pressure, high glucose, high, cholesterol, all of that together is going to lead to a diagnosis of metabolic syndrome. So some other risk factors that we haven't mentioned are listed here. And then, of course, things that you can't change: your sex, your age, your ethnicity, your family history, and genetics. But the rest of it, you can really start to make improvements. Caffeine, there are a lot of things coming out about caffeine as protective against this, but not against that. And so I think caffeine just needs to be something that you use in moderation, because there's so much conflicting information about caffeine right now. So there are studies saying it helps, and there's some studies saying that it actually makes things worse. And so I think if you're not taking a lot of, caffeine consumption in on a daily basis, don't start. But if you are, then maybe just cut back, and wait. Let's wait to see what the experts say about caffeine consumption. I think the jury is still out on that one. But definitely watch your salt intake and make sure that when you're eating salt, that you're doing something like pink Himalayan salt or Celtic sea salt. It's just better than regular table salt, but you also have to be mindful of getting good iodine and making sure that you're not affecting your thyroid health, because your regular table salt is going to have iodine in it to help. It's an additive, it's a mineral added to your salt for that reason. And so you've got to be careful about when you make healthy changes, you can also cause a disruption in other things. So just be mindful of that. Nutrition consults for these kinds of things is really helpful, and you can do that through the University Medical Center here on campus. With a $20 copay, you can call over and get an appointment, and I've done that before. I think it's super, super helpful to get tailored feedback. Of course, there's treatments for your blood pressure in terms of medication, so it's going to be the more medical model approach. And then talking about diabetes, I mentioned the most important things. Maintaining your good blood sugars is going to be super, super helpful for making sure that you're not having, kind of an expansion of your disease in terms of diabetes, but also in terms of your cardiovascular health. So, things like retinopathy, neuropathy, cataracts, glaucoma, all of that will be compounded when you have high cholesterol as well. And then this is metabolic syndrome. I've mentioned it a lot. I think it's really important. High blood sugar, high blood pressure, low HDL, high triglycerides, high LDL is what we're really thinking about too, and then excess fat. So for me, this was me 4 years ago. I had metabolic syndrome, and was walking through this. So I hope that this gives you some hope that you can make changes. And again, we're here to support you and point you to resources. So definitely reach out. So this is the holistic approach. This is my toolkit of things that you can do to make changes. So focus on what you can control, and don't worry and don't stress about what you can't, because the more you stress about what you can't control, the more you're causing health challenges for yourself. So give yourself grace, control what you can, control as much as you can in terms of stress management, and then just know that you've done the best you can and you're a human. So here are some 7 steps to a heart healthier approach to life. Get active, control your numbers, eat a heart healthy diet, live smoke free, nicotine, vape, all the substances free. And those are good steps, okay? But I also going to talk about the wellness basics. We have a class on this. We launch this class every fall when we do Strive for Five, and it's a recorded talk on wellness.ua.edu. So you can go there for the archived talk and dive in a little bit deeper. But these are the 5 to thrive and how to take care of yourself. And When I would add, if it was 6, I would say diaphragmatic breathing, really controlling your breathing and your exercising, um, is important. So making sure that when you are moving, that you're doing good breath work. There's a lot of information on diaphragmatic breathing out on the interwebs, so I'm not going to go too much into detail on that, but that's an important thing because you're needing to be focused on when you're breathing. So when you're exerting yourself, you should be exhaling, and when you're kind of more in that relaxed state, that's when you're inhaling. So, like to go to push open a door, you should be exhaling to do that. And then you can let your breath out and inhale after. And so, there's a lot that you can do with that. If you need help with that, you can get pelvic floor therapist or physical therapist to work with you, especially if you have some of these other conditions that make exercise difficult. Or maybe more, risk prone. You definitely want to have some support. Physical trainers sometimes can help with that as well, but you just have to bring that to their attention because I think sometimes we forget what other people don't know. So just ask, what am I missing here? What else can you teach me? So these are different slides. I'm going to go through these because you have access to them. And it just gives you some tips on how to focus on those 5 wellness basics. Mindset is so important. So, gratitude, what you've learned, something you've accomplished or achieved, something that delighted you. This is a really good technique for resetting your mindset. Some other practical tips: just make the next right step and right choice and stay encouraged. Monitor your progress because it's not linear. It's not point A to point B. It's going to look like a roller coaster as you're making changes on anything in your life. And then some things about smoking and vaping and tobacco use, exercise, some recommendations there, but just start with a walk, a 5 minute, 10-minute walk. I just got a walking pad this week and I'm going slow and I'm taking just a few minutes at a time. I'm not doing a lot, but just any movement's very helpful. Some information about your BMI. It is not the gold standard in my book, but it's good to know. Some more information there about the normal weight categories. It's really important to have a normal BMI if you can, but there are a lot of factors that may have you be a little bit over that, and it will say that you're overweight, but maybe it's just you have more muscle mass. And so definitely get independent, individualized feedback on that. You may just have more muscle mass. A DASH diet is usually recommended for hypertension, and this is how you look for your trans fat number. You want to see that be 0. Some more information on understanding food labels. And I know we're coming to our time, but I'll stay on to the end to make sure we don't have any questions and address what you have in the comments. Um, some things to try: turmeric, omega-3, fiber, more plant-based options, healthy fats. Try to limit alcohol, meat, processed foods, trans fats, refined carbs, and sugar. If you're going to eat a carb, try to get like a full fiber carb. It's called a FFC. A full fiber carb will be a little bit more of a complex carb and harder for your body to break down so it doesn't get converted to simple sugar so fast. And that will help you. If y'all need to go, it's 1 o'clock. You've gotten your credit and attendance and everything, but I'm going to keep on and finish out. How stress affects your body, you know this, but again, don't fixate on it because the more you worry about stress, the more stressed you get. So just recognize when you're feeling stressed. Some other resources that I popped in today, some great places to get more information that are from reputable sources if you want to do a deeper dive. And then I created this for another talk that I did unrelated to well-being, but these are the top 10 things that I would start with. So not the hard things. Get your numbers, know those, do your 7 healthy steps. But then these are the things I think that really matter in terms of overall wellness. So get out, get out of your bubble, get out of your building, meet new people, take care of yourselves, disconnect from technology, seek support, practice gratitude, take care of your mindfulness, take care of your body, stay active, get good sleep, eat well, hydrate, do all of those things. Do the basics well first. Get your numbers, and then you can start doing a little bit more each time and build on the success that you have. So this is an Arthur Ashe quote that says, "Start where you are, use what you have, and do what you can." And definitely stay encouraged. We would love for you to follow us on our social media channels, which the Wellness and Work Life team do a phenomenal job of maintaining. And then this is my information here. All right. Thanks for letting me go over